No, I'll tell you another story. Very interesting story.
Dr. KK, good afternoon. So earlier I was there recording you talking to a patient. Maybe careful. I saw you talking to a patient with a green sari. What is her name or the child's name?
I forgot.
You forgot. But anyways, I saw that you were speaking in Hindi. I didn't know, understand it was subtitles, and her face kind of changed slowly, and she got a big, beautiful smile at the end. Can you explain what was happening?
So basically, the child was told to have a fatal condition and was not expected to survive. And this was because of an error in the initial evaluation. It was told that the child has.
Who made the evaluation?
I'm not sure.
Okay, somewhere outside. I want to make sure we.
No, it was made locally.
Okay.
And it was a difficult diagnosis to make. The diagnosis was labeled as transposition. Usually, you don't have babies survive very
transposition, 1 year max. That's it.
Yeah. So this child had crossed the year, and the mother was still living in a bit of a fear.
Okay.
So when we did the echo, we realized the error was because it's a very unusual condition called anatomically corrected malposition.
Okay.
Where the heart functions normally, despite a slight variation. And it is often misinterpreted as transposition. So when you reassured the family, my mother became very happy.
I mean, that smile was priceless, doctor. You know, the transposition syndrome, right? We did the second child, Safin was transposition baby, and that's how we got introduced to Sangeeta.
Yeah, this is a disease where if you do it in the right time, it completely transforms a certain death into a completely normal life.
I mean, Safin is 12 years old now. 11 years old. Sangeeta is not with us. I miss her dearly, but at the same time, to see the work that she did is blooming in front of us is very beautiful.
It's amazing.
It's amazing. And it so happened, randomly I was recording a patient, and that patient was wrongly diagnosed as transposition, and you were able to give that joy to the family. Yeah. So what is did they have to have any surgery or anything, or nothing is needed?
Nothing is needed. So there are two things that happen in these camps. One is, of course, you identify patients who need treatment, but you also reassure those who are in distress because they think the child is having a serious condition when it is not. And that's equally important.
I mean, I have tears. You know, this is such a beautiful moment. Randomly talking to a patient. I mean, we have, if you look around, the patients have gone for lunch, so there's an empty hall up here. But so during the break, I caught Dr. KK and I'm just interviewing him. How do you feel over the last 2 days, doctor? What is the? I want to pick your brain to understand in the last 2 days what happened here.
We just saw a lot of patients. We've seen just a tremendous need for cardiac care in children, and we've seen close to 240 patients so far, and identified nearly 100 who need surgery. Obviously, it's a massive need in this region for expert services.
So we call it as a clinical desert, right? I mean, there's no access to care in this part of the country.
Perhaps.
Mm-hmm.
And there's so much that needs to be done. And of course, yesterday was a very important interaction with the government where they understood that this is a serious problem and they started to take the first steps towards addressing it locally. And with our assistance, hopefully, we would be able to make a change, lasting change.
Wonderful. Of these cases, 100 cases that you have chosen, the total cost of these surgeries, I mean, let's not worry about the funding is there or not, but I just want to understand from our perspective at Bloom to Life, what would be the cost that's required to work on these?
So it would be anywhere between approximately 2.5 crores.
2.5 crores. It's $250,000 essentially. So it's like $2,500 to $3,000 per child is the average. So we're looking at $250,000 to $300,000 needed to help save these children. So for these 100 children, what kind of time frame have you given them? So
it depends on the seriousness of the problem. There are a few whom I want them to come the next week.
Okay.
There are a few whom I'm hopeful we can manage. Even if they couple of months they take to come there, we'll be okay.
Wonderful.
And there are some whom we can wait for even 6 months. They're not really urgent. So we have the opportunity to stagger these cases.
I mean, this is a beautiful story, right? So here we are. We came in 2 days ago, and then we did a camp, and camp is still going on. You have already worked on 100 children. Now, when we look at it, there is a $3,000 per child, and in 100 child, you're looking at $300,000. But what is the efficacy? Like, when we do these surgeries to these children, what is the life expectancy for these children?
Mostly it's For most conditions, I would say 80 to 90% of the conditions, we can expect a near normal life expectancy. And not just in terms of living, but also in terms of being productive and useful and without symptoms.
So would it be okay to say at least a 60 plus, 65 years of life expectancy for most of the cases?
Perhaps.
So at $3,000 spend on one child to remove that obstacle that she or he has, to have a normal life of 60 years, it's just a beautiful impact in the life itself. What happens if these children did not have these surgeries?
Many of them won't survive.
How many years they got? Like
It's very hard to tell. There are some who wouldn't survive more than a few months.
So essentially, 80 to 90% will not be aware. So this is like these children, if not for this camp and we stepping in, there is a 99.9% probability that they would not be alive, right? Because they don't have access to care.
For a good majority. But there are a few who would be disabled, but they would be able to live. Like if you say there are a few children with a large ASD, for instance, they would be benefited immensely by doing the surgery or treatment now. And if we didn't do it, they wouldn't die, but they would lead a limited life. So there is either survival or living with limitations.
But even with the limitations, right, people think, okay, I can live with the limitation of not having a leg or an arm, but having a limitation with a VSD, right, I want our viewers to understand what does it mean. Sometimes I explained to Krishnapriya yesterday, imagine running a 100-meter dash 5 times without stopping and catching up a breath. That's closest we can imagine. Or the whole body aches because the blood is not oxygenated enough. Can you just explain about what happens? So the child lives for 15, 20 years with this large VSD. What kind of challenge is there?
Yeah, there are lots of challenges. For a VSD, the challenge is that the lung pressures will go up. The lung vasculature will be permanently damaged, and they would be having breathlessness on the slightest effort. So that would prevent them from going to college or carrying out normal activity, having a family. Those things would all be not possible.
Not possible.
Or if you have a simple lesion such as an ASD also, you would have a lifelong risk of atrial rhythm problems. You would have limitations from physical capacity. So there would be, it depends on the lesion. So what we've seen here is that we have a much larger representation of the severest forms of heart disease. We haven't seen many with minor, straightforward conditions, which I believe have been operated in few other places, not so far away from the state, but the sickest patients have been left behind for us to take care of.
I think I really appreciate you, Doctor, for speaking up. I really wanted to touch upon the last point on how is the Bloom to Life and Amrita partnership helping in this effort?
Oh, clearly, I mean, these patients, the biggest obstacle which comes in their way of treatment is not having the resources, not having the money. So what we have undertaken is that what I see with Bloom to Life is a medium through which the compassion of the community at large flows towards the most vulnerable people, that is children with heart disease.
And we are serving the most underserved children in the world. Yes. And the mission statement and the vision statement says we want to give the best possible pediatric cardiac care for the most underserved children in the world. We are starting it in India, so the mission is very simple. We want to give the best pediatric cardiac care for children, underserved children in Jharkhand, Odisha, Bihar, Kashmir is the 4 states that we want to focus while we address larger part of India as well. And I do really appreciate Amrita's unwavering commitment and support and making a difference in a child's life, Doctor. And what you're doing here is very commendable, and we appreciate that. Any closing statement, Doctor, before we call it a day?
Just the fact that Amrita is committed from day one, and Amrita and Bloom to Life resonate totally in this mission. So there's just a question of being partners in this process.
Wonderful, Doctor. And this, thank you. With this, I call it a day. Thank you so much. Appreciate it a lot.